Lung cancer remains Canada's deadliest cancer, claiming more lives each year than breast, prostate, and colon cancer combined. Listen close. A new campaign from Merck Canada is aiming to change that statistic through highlighting early detection. Joining us this morning to share her story is lung cancer awareness advocate Katie Hulan. Good morning, Katie.
Good morning.
Katie, thanks so much for joining us and for being here to share your story. You've actually gone through a lung cancer diagnosis. What led you to seek medical attention, and what was going through your mind when you first got the news?
I was first diagnosed after several months of trying to figure it out, really. So it started off with a slight cough, more like a clearing of the throat for a couple weeks. Developed into a cough, and it got to the point where I really needed to seek medical advice. So I went to my doctor. We tried multiple different things to figure it out. Asthma puffers, went to a specialist, but it was a CT scan, an X-ray, and then blood work that showed I had a mass in my lung. We still didn't know what it was, and I was 33 at the time. I don't think any of us thought about lung cancer. I was rushed to emergency after receiving some of these scans back, thinking it was a blood clot, but I ended up finding after a few more tests in the emergency room that I had a cancer diagnosis.
What was going through your head when you found out?
I was shocked. I was relatively healthy aside from a cough. I really didn't have too much else other than that symptom. So to be diagnosed with cancer at all at 33, considering, I was working out, I was working every day. There was nothing that was really pausing my life.
Yeah.
And so a cancer diagnosis was shocking.
What misconceptions about the disease do you wish more people understood?
Yeah, there's definitely a few. And it wasn't until I was diagnosed that I even knew myself. So I certainly thought if you had a lung cancer diagnosis, you were more likely to smoke, or you were working in an environment maybe that exposed you to chemicals or something like that. But that's not the case. A lot more people are being diagnosed now that have not had a smoking history or small amount of smoking in their past. The other thing is that more people are getting diagnosed under the age of 50. So you think of cancer diagnosis of being kind of older, past 65, that's still young, but we're seeing more and more cases like myself being diagnosed in their 30s and 40s.
Wow, how's your life changed, Katie, after your diagnosis?
Yeah, it's been a ride. I have gotten better every year since. It's been 4.5, and I have had a lot of success in terms of seeing my cancer go away and then it come back. And so those moments are tough. And I've had to rely on my community and, the healthcare system to get me through those moments. But it's also given me a chance to understand more about lung cancer and to advocate and to make sure people are aware that, anyone with lungs can get lung cancer, and that we need to continue to improve, healthcare and the experience for lung cancer patients in Canada.
Absolutely. And I'm happy that you are here with us today, looking healthy and sharing your story with us. Where can Canadians find more information about lung cancer prevention and early detection, seeing that it was good for you to have that early detection as well?
Yeah, so listenclose.ca, there's a website there, and there are resources, there's a quiz even, and it lets you understand a little bit more about your situation, but also gives you talking points for your doctor. So my biggest suggestion right now is that listening to your lungs, understanding any changes in your lung capacity is so important, regardless of whether you smoked or not. It's, your lungs are so important. So definitely check out that resource, and it gives you a little bit more information about anything you might be experiencing.
All right, Katie, lots of information there that we can all benefit from. So thank you so much for your time and for sharing your story with us this morning.
Thanks so much.